please be seated. Dear guests, parents, grandparents, significant others, welcome to the 2026 Postdoctoral graduation ceremony. It is the last graduation ceremony for Columbia University. However, it's the most interactive and heartfelt of all the ceremonies. It is truly worth the wait to honor these elite group of graduate students. So once again, another round of applause. It is also special when one of the university's spiritual leaders truly embraces this school and has been totally immersed in our dental culture. Now, Reverend Dr. Ian Rottenberg will start our ceremony with the invocation.
Graduates, friends, families, faculty, this is a day for congratulations and joy and celebration. As we gather for commencement, let's do so in a spirit of reflection and gratitude and blessing. We acknowledge all that this day and moment mean: the dedication, the sacrifice, the accomplishment, the untold hours of work, dedication, and wisdom transferred across the years from teachers and mentors to students who now take the mantle of vocation. We give thanks, grateful for the support of loved ones, for a university community dedicated to knowledge and care, and for these graduates who have given of themselves so wholeheartedly to this work. May our words and celebrations of this time together be blessed in every way. As we celebrate the accomplishments of our most remarkable graduates, may our hearts be full, and may our joy be complete. Amen, and congratulations, class of 2026.
Thank you, Reverend, for being here for us as always. All aspects of dental education, whether it's pre-doctoral or postgraduate, are more complex than any other academic discipline. Law schools do not run law firms or courtrooms. Business schools do not run a business. Architecture schools do not build skyscrapers. And medical schools, for the most part, do not run hospitals. But dental schools run dental clinics, dental labs, practices, in addition to providing world-class education and producing innovative research. Therefore, it takes a special type of leadership and a unique set of skills to run a dental school at the elite level that Columbia does. CDM is extremely fortunate to have just such a leader, our Dean, Dr. Dennis Mitchell.
Distinguished graduates, faculty, families, friends, and honored guests, good afternoon. We gather here to celebrate an exceptional group of clinicians whose dedication and accomplishments have brought them to this important milestone. Today marks the culmination of a demanding work and remarkable achievement of these individuals. On behalf of Columbia University College of Dental Medicine, I offer my warmest congratulations to the graduating class. Your advanced training has prepared you to practice at the highest level of your specialties. Through intensive clinical training and patient care, you have developed the expertise and judgment that will guide you throughout your careers. You leave Columbia ready to help and shape the future of our profession. In the years ahead, patients will look to you, not only for treatment, but also for reassurance during the difficult moments. You will help people eat comfortably again, smile with confidence, and return to daily life without pain. The impact of that care extends far beyond the clinic, and it is one of the greatest privileges of this profession. As you move forward in your careers, I know you will continue to engage with new ideas and advances in the profession while learning from those around you. Dental medicine continues to evolve, and progress will depend on clinicians like you who are willing to share ideas across disciplines in the service of their patients. I hope you carry forward the spirit of collaboration that defines this institution and the understanding that the best care is rarely delivered alone. Congratulations, graduates. May this occasion be a celebration of all you have accomplished and the beginning of an exciting life journey. Thank you for choosing Columbia University College of Dental Medicine for this important stage of your training. It has been a privilege to have you as part of our community, and I wish you continued success in the years ahead. Congratulations, and please stay in touch with your CDM family.
Thank you, Dean. I just want to briefly even address the parents, the significant others, the grandparents, and our graduates about the responsibility of the holders of advanced dental degrees. You're an elite group of dentists that have sacrificed time, finances, delayed entry into professional practice, time away from family and significant others. It may have taken from 1 to 6 years to achieve this goal. It is part driven by knowing that when you wake up every morning, you cannot conceive of doing any other discipline of dentistry but your chosen specialty. It is the individuals trained beyond the requirement of 4 years of dentistry that continue to actually expand the scope of the profession. They form the core of our researchers, scholars, educators, policymakers, and provide the most complex procedures for public seeking the highest level of oral health care. The extra years are demanding both on the residents and their family. The residents leave the program more profoundly changed than when they left dental school. For the patient, many times that one with the specialty degree is the last resort for correcting their oral health issues. They serve many times also as a source of overall health for their patients, more so than our physician colleagues. They provide information and direction at the same level as the physicians. This is not necessarily an easy responsibility on any level. Many times, there is no next level to refer. The buck truly stops with you. The next responsibility is to remain at the forefront of knowledge and the techniques in your discipline. These specialties have to totally embrace bringing lifelong learning. This is easier said than done. Finally, there's a responsibility to maintain the status of our advanced disciplines as recognized unique specialties. This requires board certification and constant renewal of that certification. I know all our graduates and family members are celebrating that all the years of education are finally over. So enjoy this moment, but I will tell, as I tell all my residents, the best part of their career when they look back will be these years at training at CDM. Especially then if you totally embrace all these responsibilities that I put forth. So we're also fortunate today to have one of our past graduates who I think exemplifies all these responsibilities. Dr. Angelo Stuni received his DDS from Columbia University, his MD from Columbia University, and his certificate in oral maxillofacial surgery from Columbia University. He's here to bring greetings from our Alumni Association, and he will be presenting you with a small token of the Alumni Association's gratitude to all of you. And all of us, the hope is that as the years go by, okay, you do stay active with our Alumni Association. So now, our Vice President of the Alumni Association, Dr. Stuni.
Good afternoon. Congratulations. On behalf of the Association of Dental Alumni, I'd like to congratulate you again on your accomplishments and on your graduation today. I welcome you as our newest members of the CDM Alumni Association. Graduations represent the end of a journey and the beginning of a new one. Today, your formal education concludes. Enjoy it, cherish it, revel in it, be proud of all of your accomplishments. Tomorrow, real life starts, and you will embark on the next phase of your professional life. Whether you join a private practice, build your own clinic, join the faculty of an academic institution, this new path will take you to places. Some are going to be desired, some may be beyond your imagination or expectations. It will take more hard work, commitment, sacrifice, but you're ready. And your Columbia education has prepared you for what lies ahead in many ways, in ways in which you don't even realize today. You'll continue to need your support from friends, from colleagues that you've made here. Look around you, it's full of colleagues. The room is full of colleagues and full of support. And so I encourage you to lean on these relationships. Stay connected, nurture these relationships. The CDM Alumni Association and its members will also be here to support you. Join us for our continuing education courses and special lectures. Attend our social and professional networking events. Connect with us at the receptions for your respective specialty associations' annual meetings. You're also now members of the greater CAA, the Columbia Alumni Association, which consists of over 400,000 alumni across the world. Engage with your fellow Columbians through the global clubs and alumni interest groups wherever you practice. Most importantly, and finally, I'll keep it short, I would like to encourage you to remain and become actively involved with CDM. Support our Dean's initiatives, become a mentor to the current dental students, and I cannot emphasize that enough, and come back. Join the faculty as a volunteer, as I've done, as I continue to do, and pay forward the gift of your education to the next generation of colleagues. So once again, let me congratulate you and all of your families on a job well done, and I hope to see you again at graduation next year for your colleagues and at reunion weekends in the years to come. Congratulations again.
Some of you in the audience who are here this morning met or saw Dr. Alan Formicola, Dean Emeritus. And we decided over the years that he was so instrumental in dental education that an award should be developed in his name, the Alan Formicola Award. His focus has always been on that the importance in education for many of you comes from our volunteer faculty, who, especially those who have dedicated their time to postgraduate education. And many of you have been blessed to have worked side by side with many of our volunteers. They bring real-world experience. They're there to help you understand when you actually get out into practice. It's an honor this year to invite Dr. Pimenta, the chair of the Division of Prosthodontics, to present this year's winner.
First of all, congratulations to all of you graduating today. It's been a pleasure working with you all throughout these years. We don't have pros residents graduating this year because of the year gap, but I'm very happy to see you all here, and I know that in one way or another, we have worked together and I have contributed to your graduation. So we are very happy to have you here. So good afternoon, Dean Mitchell, Dr. Fine, my colleagues, faculty, staff, residents graduating, and your families and friends. It's a great pleasure to be here today as we celebrate our graduates and recognize an outstanding educator in our community. It's my privilege to introduce Dr. Ben Rich, recipient of this year's Alan Formicola Volunteer Faculty Teaching Award. Dr. Rich has made a meaningful contribution to our postgraduate prosthodontics program through his dedication to teaching, mentorship, and to help the residents' education. He's highly respected and admired by our residents and has received consistently high teaching evaluations year after year. Unfortunately, Dr. Rich is unable to be here with us today, but he shared a few remarks that I would like to read on his behalf. Quote, "I'm deeply humbled and honored to receive this prestigious teaching award. I accept it with sincere gratitude, knowing that no one is an island and succeeds alone. We are all part of the same whole. I would first like to thank the leadership of the college, beginning with Dean Mitchell, for his continued guidance and support, and also grateful to Dr. Jim Fine, who led our program through some tumultuous time. To Dr. Pimenta, thank you for your friendship and for bringing renewed energy and vision to our department. To Dr. Wu, whose daily dedication keeps us all striving to our very best. We all look forward to Dr. Wu's email time-stamped in the middle of the night. In a more personal level, I want to recognize my close colleagues and friends, Dr. Joseph Maniscalco and Dr. Candace Zamenik. The three of us constantly exchange ideas and work together to give our students not just one perspective, but multiple voices that bring depth and nuance to every case, even if the students think we are cloned. Most importantly, I want to thank our students. Your curiosity, determination, and constant pursuit of excellence inspire all of us to become better teachers, better clinicians, and better people. You are the very best. It's a privilege to be part of the College of Dental Medicine community. Thank you all very much." Unquote.
Take on his behalf. Thank you.
Thank you.
Are there where's our staff? Can they stand up? Our dental assistants, Paris, get your crew up. I just want, they love you, okay? All of you. I mean, the families, you need to know that they take care of our students all the time. So I deeply appreciate it, Paris, appreciate what everyone does. Thank you. Well, now's the time you've been waiting for, and this becomes the interactive part, right? This is where everyone gets involved. So probably he is so calm, nothing ever bothers Dr. Kim, okay? And the endo, no, it's not true. And the endo residents always cry when Dr. Kim comes up and introduces him. Dr. Kim.
Congratulations to all graduates, loved ones, families, and friends. Every program is built twice, once in its curriculum and once in its culture. And I believe that second is much more important for the program's quality. Culture is one of those quiet, invisible forces that rarely fail in any single moment, yet utterly foundational to the survival and prosperity of every organization, every institution, every society that endures. It shapes how we treat each other and how we learn, how we grow, and ultimately who we become. I think about this every day. Every conversation I have with the residents in the hallway, every case conference, every moment of mentorship, these are not incidental. They are acts of the investment in the architecture of the program. Together with our students and colleagues and staff, we have engaged in the deliberate work of transformation, moving our program culture from relative passivity to one that is active, inclusive, and genuinely welcoming of every voice, every background, every perspective. And this shift has not happened overnight. Change rarely does. But it has happened slowly and steadily. And the proof is in our graduates before us today. This year's graduates of our postdoctoral endodontics program are, in every sense of the word, extraordinary. Through their residency, they have demonstrated commitment to clinical excellence by providing compassionate, high-quality care to every patient who trusts them with their health. And they approach academic dimensions of the program with equal seriousness and diligence, engaging deeply with the science and standards that define our specialty. I'd like to say that the program cannot be structured only with the few people. All our residents are the core of our program, and then program changes every year. I'd like to introduce our postdoctoral residents, and please come up to the stage as I call your name.
They're going to announce it for you. When you call them up, this is like doing root canal here. It's going to take forever. Go ahead.
Yes, yeah.
Dr. He Jo On. Dr. Alec Donelian.
I know.
Dr. Joshua Lee.
The picture.
Dr. Rebecca Lee. Dr. Mark Park. Dr. Zhuijin Tracy Xu.
To, to our graduates, you have given your very best to our program, and our program and I have done its best to give you the foundation you need to lead, to serve, and to innovate throughout your careers. I'm very proud of each and every one of you. Thank you, and congratulations again.
Who's the two speakers? You two?
Good afternoon, everyone. Thank you for joining us today to celebrate our graduation from endodontic residency. We want to begin by thanking Dr. Kim, the best program director we could have asked for. Dr. Kim, you've gone above and beyond at every turn to give us the best possible experience throughout residency. We're so thankful not only for everything you've taught us in clinic and the classroom, but also for your dedication. You were there for the difficult cases, the long days, and the moments when we needed guidance the most. Your standards pushed us to be better, and your support made it possible to meet them. We are the clinicians we are today because of you, and we will carry what you taught us into the rest of our careers as practicing endodontists. Thank you, Dr. Kim. We also want to thank the rest of our faculty, Dr. Kang, Dr. Boside, Dr. Magahis, and our volunteers. You've shared your time and experience generously, challenged us to think more carefully, and modeled what it looks like to practice our specialty at the highest level. We are deeply grateful.
And to our families, partners, and loved ones, thank you for the years of patience, encouragement, and quiet sacrifice that made this possible. The names on these diplomas are ours, but the path here to get here was never walked alone. We could not have done this without you, and you know it. And to our co-residents, congratulations. We've spent these past 2 years side by side, learning together and pushing each other to be better each day. You are great clinicians and even better people, and we've learned as much from each of you as we have from every lecture and any textbook. As we go out into practice, we have no doubt about what each of you will accomplish. You are going to do excellent work. You're going to take care of people who need you, and the field of endodontics is going to be better for having each of you in it. Thank you all, and congratulations to our graduates.
There were a couple of tears, right, from the endo? Our Masters of Science program in orthodontics is headed up by Dr. Chen, who's a meticulous orthodontist, and she's here to set us all straight.
Okay, thank you all, graduates and family, for joining us to celebrate the graduation of class 2026. The story of orthodontic specialty in Columbia University started in 1922. In that year, the dental school offered a 12-month course for graduates to prepare them for specialization in orthodontics. In over 100 years, it has developed into a 3-year program for a certificate and a master's degree. In the past 30 years, along with the development in the field of material, computer sciences, and imaging technology, there are significant advances in orthodontic treatment modalities. We have been able to integrate this cutting-edge knowledge and technology into the orthodontic education, treat not only malocclusion, but also craniofacial deformities, growth modification, and multidisciplinary cases with cooperation with other specialties. And 3 years ago, these 7 students joined us with their strong background in dentistry, started their systematic training in orthodontics. They have been formed an efficient team to work together through all kinds of challenges, including academic, clinic, social, and the unexpected challenges of the past-pandemic recovery. They have successfully managed the spaces and the time, so they were sufficiently trained in diagnosis, treatment, and management of orthodontic patient care. Clinically, they provided excellent patient care. Academically, they were able to conduct research on multiple aspects, including research on long COVID symptoms in oral cavity, analyzing occlusal changes along with clear aligner therapy, and evaluate accessibility to orthodontic treatment with Medicaid fundings. They also explored the application of ultrasound technology to manage alveolar bone changes during and after orthodontic movement. This research won the Resident Research Award of NISO and the AOF. Finally, they all passed the written exam of American Board of Orthodontics and are ready to take the clinical exam to become board-certified orthodontists. All the challenges and achievements just made them strong, so today it is celebration for their success. I truly believe they will be excellent orthodontists and be able to provide success services to their community. Now I'd like to invite the 7 graduates of class 2026 to the stage.
Dr. Sylvia Bila.
Dr. Baylor is coming from the Columbia Dental School, and she will go to North Carolina to join her husband to practice there.
Dr. Melissa De Guglielmo.
Dr. D. Guglio Elmo also graduated from Columbia Dental School. She will practice in Scottsdale, New York.
Dr. Ji Won Kim.
Dr. Kim comes from NYU Dental School, and she will practice in Pennsylvania.
Dr. Nikisha Lewis Elias.
Dr. Louis Elias comes from Tufts University Dental School, and she will also practice in Pennsylvania.
Dr. Amanda Rachel Siegel.
Dr. Siegel is our CDM graduate. She will practice in tri-state area.
Dr. Mackenzie Stevens.
Dr. Stevens graduates from Tufts University. She will practice in Long Island.
Dr. Colby Taylor.
Dr. Taylor is graduate from UCLA, and he will practice in Colorado. So now our class representative will give their remarks.
First, we would like to take a moment to thank our full-time faculty for making this education possible, specifically Dr. Wadwa, Dr. Chen, Dr. Ohe, and Dr. Schechter. I chose to come to Columbia because my older brother, a current Columbia resident at the time, told me it was the best program in the nation, and he was right. From my first day as an extern to this moment now, I've always felt supported and have thoroughly enjoyed learning from our attendings. They taught with their perfect balance between providing the guidance we needed to become excellent orthodontists while also encouraging us to think independently and to continue learning on our own, a skill that has prepared us to take our next steps beyond graduation.
This experience would not be complete without recognizing how fortunate we are to have trained alongside such incredible co-residents. Over the last few years, we've celebrated our success together, supported each other through long days and stressful moments, and built friendships that will last far beyond residency. To our families, friends, and loved ones, thank you for the constant encouragement and sacrifices that helped us reach this moment. And finally, to our patients, thank you for trusting us with your care and allowing us to be part of your lives and smiles. We are incredibly proud to be graduating from Columbia, and we are excited to carry everything we've learned here into the next chapter of our careers. Thank you all so much.
This dental school has always been unique. It has some of the things where we're the first dental school to do certain things. So those of you who heard Dr. Mitchell talk this morning about the integration of a medical type curriculum through Dr. Geese into our educational system. We were the first school to have a periodontics program, oldest in the country. We have produced many elite people coming through this program. Such people as Bob Gottsagen, probably is our first graduate. Other famous, well-known periodontists such as Lorene Langer, Susan Carabin, and Dr. Peter Wang. So this program has been truly blessed. Every year I say, well, how can we keep on topping that? But we managed to do that. We have a fantastic group graduating this year. And one of the things that's been pointed out that's fairly unique about our program is that we bring them in and we say, here, you're going to do the most complicated procedures with no preclinical exercises. This was pointed out to me earlier this week. It's like, go into a room, here's a patient needs a sinus lift, and you just start from there. And that takes a unique group of residents that have to be selected. Those that are driven, those that are self-starters, and those that are motivated. And I deeply appreciate this group. They've been incredibly helpful. They are helpful to their underclassmen. They're helpful to the dental students on their teaching rotations. So this is a fantastic group of people. 2 of them are receiving their masters, and the others are receiving their certificates in periodontics.
Dr. Nick Chen.
Yeah. Nick is well loved. That's why he's going to practice in Las Vegas. Thank you. Right here to him.
Dr. Sahar Fazel.
She graduated from our DDS program, and she's been one of my 2 chief residents, and she's incredible, and she's staying in the tri-state area, and she's going to come back and help teach. You've been incredible.
Dr. Samira Talagani.
She came from the West Coast, but now she's staying with us in the tri-state area, going to practice and start her family.
Dr. Amanda Gramercy.
Amanda's the other chief resident. She always says she was my favorite resident. That's why she's staying in Manhattan. And she's also receiving her MS.
Dr. Joshua Lin.
Josh is also staying in the tri-state area, close in Connecticut. He's also receiving his MS, and he's been a fantastic DDS student and postdoc student for us.
Go forward, left.
Go this way around. the podium awaits the two of you.
Good afternoon, everyone. On behalf of our class, thank you for being here to celebrate this incredibly special milestone with us. 3 years ago, the 5 of us walked into Columbia Vanderbilt Clinic, waiting the usual 10 minutes for the elevator to crawl its way down to the ground floor, then back up to the 9th, naively organizing our perio instrument cassettes, deeply confused about what a baby boozer elevator was or what an Orban knife even looked like. And after ending our day at our first suturing workshop, we walked over to Fort Washington Public House, ordered a round of Guinness, took our first group photo, and felt genuinely excited. In retrospect, we had absolutely no idea about what we were about to endure.
These past 3 years have been unforgettable. We've had some incredible highs, our first surgeries that somehow went according to plan, late-night Korean barbecue dinners with Dr. King and Dr. Chen, and the moments when we got to see our patients heal and smile because of the work that we did. And then there were the surgeries that truly humbled us, the cases that did not go quite the way that we imagined, but honestly, looking back, those are the moments that taught us the most. We somehow survived the 4-hour Monday morning lit review sessions, where one article could turn into an existential discussion by hour 3. We survived Tuesday morning classes that seemed to operate outside the normal laws of time and human consciousness. And of course, the late night Zoom board review sessions where someone was always confidently answering a question completely wrong, while the rest of us silently prayed Dr. Hung wouldn't call on us next. Somewhere between the stress, exhaustion, many surgeries, and endless articles, we became more than core residents. We became the only group of people who truly understand what these past 3 years felt like.
And then there were the smaller indignities of residency life, like the seemingly monthly, "We are aware that clinic temps are higher than usual" emails received while dripping in sweat during surgery, or the perio lounge, our sanctuary, which for 3 years had no water cups, not one. You would think that a grad program at an Ivy League institution could source a sleeve of Dixie cups, but no. And so it was that we watched Josh, our co-resident, fill sterile gloves with water and drink from one of the fingers. And we did all this in Washington Heights. For anyone who hasn't had the privilege of training in this neighborhood, let me paint the picture. You step off the A train on 168th Street, and you're immediately wrapped in the smell of mofongo and at least 4 simultaneous phone conversations happening at full volume. It is one of the most alive corners of New York City, and it was our classroom. There are many people we would like to thank along the way for making us into who we are. And I want to start by thanking our patients, the center of why we are here today. There are no words to express our gratitude. I remember, as a first-year resident, it may take me over 4 hours to complete osseous surgery. And yet, when we finally sutured up, they would look up at us with the most genuine gratitude, thank us, and tell us our hands were like angels. Our patients made us into the clinicians that we are today, because they didn't just come in with 7mm pockets and class 3 furcations, they came in with stories. And although some came from financially disadvantaged backgrounds, they were rich in spirit and in generosity. They taught us something that no lecture could, that care is care, and that when a patient trusts you enough to place themselves in your hands, that is sacred.
To our amazing assistants, Liz, Yami, Crystal, Selena, and Angie, and our implant coordinator, Francis, thank you. You kept us organized, grounded, and somehow always one step ahead of whatever chaos we were about to create. You stood behind us through the endless surgeries, the stressful days, the back pain, the wrist pain, and still showed up with patience, kindness, and probably a secretly timed dual-axial Advil just to make it through another 4-hour procedure with us. We truly could not have survived residency without you. And to our faculty, thank you for guiding us, pushing us, and believing in us, even when we made you question that decision. You challenged us to think deeper, work harder, and hold ourselves to a standard we didn't always know we were capable of meeting. The clinicians we are today is a direct reflection of your investment in us, and we don't take that lightly.
Lastly, we would like to thank our families. I'd like to thank my mom, dad, Jacob, Betty, Steve, Riley, Tito, and all the friends along the way that have encouraged me to keep persevering even when it got tough. And a special thank you to my wonderful fiance, Marley, who has been my entire rock through this.
And I would like to thank the people who carried me throughout this journey, not just these past 3 years, but really the last many, many, many years of school. My parents, Perry and Sid, thank you for supporting me through every exam, every stressful phone call, every moment of self-doubt, and every milestone along the way. To my brother Farshid, thank you for always keeping me grounded, making me laugh when I needed it most, and reminding me there's life outside of all of this. After more than 25 years of school, I can finally say, I did it, we did it, and for the first time in my life, no more school. Like seriously, no more school. As we stand here today, it's hard not to feel emotional. This program has given us so much: skills, knowledge, resilience, confidence, and lifelong friendships. It pushed us to grow in ways we never expected, and while we're excited for what comes next, a part of us will always belong in Washington Heights. So to my core residents, thank you for the laughs, the support, the late nights, and for making these years unforgettable. Congratulations to all of us. We made it. Thank you, everyone.
We've been extremely lucky that our program directors have done multiple tours of duty. They've gone through multiple accreditations. They're highly experienced, and that's why and highly dedicated to their residents. Not that she's totally new, but she has just completed her first, I think, full year tour of duty in probably the largest program that we've ever had at Columbia. We'll bring up Dr. Garu Gonzalez to do the AGD program and her 30 residents.
Faculty, colleagues, family members, and most importantly, our graduating residents. Today is a special day, not because you're finishing the AGD program, but because everything it took to get here. This year was filled with learning through challenging cases, new experiences, and moments that push you to think critically, adapt, and grow as clinicians. You came here with different backgrounds and experiences, and over this year, I have seen each of you grow in your clinical skills, judgment, confidence, and resilience. Many of you were far from home, adjusting to a new program, new environment, and for some, life in New York City. That is not easy, and it makes this accomplishment even more remarkable. And while each of you have your own journey, what makes this group truly special is the way you learn alongside one another. The support, the teamwork, the shared challenges, the friendship you built this year became just as important as the clinical training itself. To your families, thank you for the support, the patience, the encouragement that helped this journey possible. To the AGED graduating class, as you move forward, whether in private practice, specialty training, or another path, stay curious, stay humble, continue learning, and remember how much you have grown this year. And as you begin the next chapter, don't forget about Columbia. Don't forget the standards you learn here, the friendships you build, and the people who helped shape this journey. Stay connected, support one another, and make us proud. It's been truly a privilege to be part of this journey with you. Congratulations, class of 2026. I'm incredibly proud of all of you. Now I will ask the residents to come up.
Dr. Bahi Abualan. Dr. Muafak Al-Khani. Dr. Hiba Al-Ogaidi. Dr. Ricardo Carvalho. Dr. Jessica Castaño. Dr. Yaselsa Castro. Dr. Eduardo Cordero. Dr. Maylene de Moya Cordero. Dr. Annabella Frattaroli. Dr. Celeste Hernandez. Dr. Masa Maliki. Dr. Brianda Montero. Dr. Madeline Rodriguez. Dr. Juvier Rodriguez Cuevas. Dr. Ali Sadiq. Dr. Yashita Sethia. Dr. Brian Vargas Rondon.
The picture. Dr. Adriana Molina. Dr. Manuelisa Mota.
These are 2-year. Just say that you're disagreeing. It's 2-year people.
Oh, these residents are the second years. Second year residents.
Dr. Jennifer Nunez. Dr. Scarlett Rodriguez. Dr. Marfani Rodriguez Torres.
These are our NYP residents.
Dr. Christy DeBrucy. Dr. Haley Grandeau. Dr. Sufia Hassan. Dr. Hyung Jae Jung. Dr. Neela Lahijan. Dr. Dong-hee Lee. Dr. Anthony Nguyen.
Blank. You're going to take your photos and bring your speaker over? This chief is going to speak.
Now the Chief Resident, Manuelisa Mota, we're gonna give some remarks.
Good afternoon, everyone. On behalf of the graduating residents, I would first want to thank Dean Mitchell, our program director, Dr. Garau, Dr. Evangelides, and the rest of our amazing faculty, our amazing dental assistants, our PSA departments, our dental receptionists, our patient advocate office and PSA, and everyone behind the scenes whose patience, guidance, and support helped carry us through this journey, even during the moments when we doubted ourselves. Residency is often described as a period of advanced training, but for us, it became much more than that. It became a place where we grew, not only as clinicians, but as people. We learned to lead under pressure, to support one another through the difficult days, to celebrate the small victories, and continue showing up with compassion with every patient that sat in our chairs. This program challenged us, shaped us, and reminded us that dentistry is not only about dental treatment plans and procedures, it's about people. It's about trust, empathy, teamwork, and service. To my co-residents, thank you for becoming family. Thank you for the laughter during the long clinic days, for helping one another when the schedules felt impossible, and for proving every day that excellence and kindness can coexist. I truly believe this group is special, and I feel incredibly proud to have walked this journey beside you. Columbia became much more than a training program, and for many of us, it became a home. In my case, quite literally, since I'll now be staying for another year in the New York Presbyterian Hospital GPR program. And while this journey shaped me professionally, it also reminded me how important it is to recognize those who have shaped me personally. I want to acknowledge the original Dr. Modas in the audience, my parents. Thank you for showing me through your own example, the dedication, sacrifice, humility, and what service looks like. Everything I am today began with the foundation you gave me. Gracias, Mami, Papi, Ling, y Bianfi. To my husband, who is not only my life partner, but also my co-resident, because apparently seeing each other at home every day wasn't enough. Thank you for walking beside me through every challenge and every victory. To my daughter, Brianna, thank you for giving every long day a purpose greater than myself. After all, being your mom is my greatest accomplishment. Finally, to all of our families, thank you for every sacrifice, every encouraging phone call, every late night conversation, and every moment you carried us through when we were exhausted. After all, none of us got here alone. Today we graduate with certificates, but more importantly, we leave with friendships, with memories, resilience, and a responsibility to continue taking care of others with integrity and heart. This moment represents years of sacrifice, perseverance, and dreams that once felt very far away. Standing here today is proof that those dreams are possible. Congratulations, class of 2026. The future is bright, and this is only the beginning. Thank you.
As I said, the AGD program is our largest program, but every year they have more love for Columbia, I think, than any other group. So I deeply appreciate our AGD residents, and congratulations on your graduation. Behind the scenes, in order to run all postgraduate education, there's a support team. Some of you see the support team, some of you, they move in and out. They involve our section administrators. They also involve our curriculum director, Michael Waring, Gail Linares, who works with Michael Waring also, Melissa Wells, who also doubles helping out on different events for us besides being the alumni director. Jerry Connors helps out. So it takes an enormous number of people to actually help us. One of our section administrators, unfortunately, who we all love, Rodney Kopek, had passed away earlier this year. And so I know he's looking down on all of you, and he wishes you all well. The next program is the General Practice Residency Program. We're now moving into our New York Presbyterian colleagues. This program is headed up by our dynamic duo. They're never separated. They always come together, Bunza and Aglaki.
Either way is fine. So the General Practice Residence Program takes on many different roles here at Columbia. Though they are all recent graduates, they have rotations in various programs, and their responsibilities include a first-year oral maxillofacial surgery resident. They rotate through the hospital's ENT program, where they take on the responsibilities of a first-year ENT resident. And also the same is done in anesthesia. They have to learn quickly and accurately new skills that they were never taught in dental school. and they have to do them well. And I want you to know that these residents have done this and done this exceptionally well. Their dedication and hard work are obvious to all, and they consistently go above and beyond what's asked of them. They are highly motivated and always available to help, and great to work with. And so I congratulate our residents and all of you graduating today on your accomplishment and wish you well in all of your future endeavors. Also, I want to thank Drs. Isaac and Koch for their enthusiastic and steadfast support of our program and residents. I want to thank our 2 oral maxillofacial surgery residents graduating today, Drs. Sophie Jelenke and Lindsay Rutherford. They are the GPR's first line of supervisors, and they're always available to teach and help the residents. And I especially want to acknowledge and thank our program's Associate Director, Dr. Layla Aklari, for all of her dedication and hard work and in teaching and mentoring our residents. Now, I'm very proud to present to you the 2026 class of general practice residents.
Dr. Alexander Constantine.
Alex comes to us from Touro University College of Dental Medicine and will be joining his family's dental practice next year. No hope.
Dr. Simrit Dinsa.
Simrit came to us from the University of California at Los Angeles School of Dentistry and will be going into private practice.
Thank you, Doctor.
Dr. Yanil Garabito.
Janelle graduated from the Universidad Ibero-Americana in the Dominican Republic and the College of Dental Medicine's AGD program. And will be going into private practice. Did I pronounce that right?
Yes.
Dr. Tori Lee.
Tori graduated from the Arthur A. Dugoni School of Dentistry at the University of Pacific and will be going into private practice.
Dr. Matthew Tanser.
Matt is our chief resident, and he graduated from Columbia University College of Dental Medicine, and he will be going into private practice. One graduate who could not be with us today is Jacob Mendoza Jacobo. Jacob came to us from the University, NYU College of Dentistry, and he will continue here next year as our chief resident. Congratulations to all the GPRs and everyone else in the class of 2026. Thank you.
Good evening, everyone. First, I would like to congratulate all of the postdoctoral graduates, as well as the families and friends who join us in celebration today. My name is Matthew Tanser. I'm the chief resident for the general practice residency. For those who know me well, I can assure you I was only given a few minutes to speak, so I will do my best to keep this appropriately brief. While there's far more to me than dentistry, my identity as a clinician through the training I have received, the mentorship I have been fortunate enough to experience, and the doctor I continue to become has been profoundly shaped by this institution. I would like to sincerely thank CDM, New York Presbyterian Hospital, our faculty, attendings, and both the front and back office staff whose work is essential to everything we do. I stand here excited, but also appropriately humbled as I prepare to enter private practice. Dentistry is a lifelong pursuit. No amount of pre- nor postdoctoral training can produce a veteran dentist, and no clinician ever stops learning. What gives me confidence moving forward is the foundation we received here, built on rigorous clinical exposure and mentors who taught us not only how to treat patients, but how to think, adapt, and grow as providers in our field. I know my co-residents and I will leave here better clinicians and stewards of the profession because of our training at CDM and New York Presbyterian Hospital. One of the most defining aspects of our GPR program is the care we provide for medically complex and special needs patients. Each year, under the leadership of Dr. Bunza and Dr. Agalaki, our residents complete approximately 50 operating room cases, providing comprehensive dental care under general anesthesia, a service we are able to provide for our special needs and medically complex patients that is seldomly found in New York State outside of our institution. From day one of our training, we were informed that the patients we care for at New York Presbyterian are amongst the sickest population of patients in the country. Individuals who could not find a dentist willing to treat them due to their medical complexities, or medical teams who did not feel comfortable with their patient receiving dental treatment outside of an academic hospital setting. These are the patients my co-residents and I routinely treated every day, focusing on our growth as doctors and not just advancing our bread and butter skills as tooth mechanics is what made it possible for these patients to have a dental home previously not accessible to them. In doing so, we had the privilege of practicing at the forefront of where dentistry should be, the direction it is hopefully going, and not just where it has been. The fact that some of our patients travel hours to receive care here is a reminder that there is still more work to be done by our field. Real change often begins locally before it becomes the standard. So to my co-residents, I hope we continue to share what we've learned, continuing mentoring those who follow and advancing access to care for medically complex and special needs patients. To CDM and our New York Presbyterian Hospital, thank you for an extraordinary training experience and for investing in a model of care that expands access for vulnerable patient populations. I encourage you to continue advancing this mission because what is considered specialized today can become the standard of care tomorrow. Finally, I'd like to extend my deepest gratitude to Dr. Bunza, Dr. Agalaki, our oral surgery attendings, for their mentorship and dedication in preparing us to care for patients who too often have nowhere else to turn. Their leadership is helping move our field toward a future where care for medically complex and special needs patients is not the exception, but the expectation. Thank you.
Don't forget your certificate, unless you want to come back next year. We'll charge you, though. We have a certificate in oral and maxillofacial pathology. Victoria Scarpa, I don't think, was able to attend today. We'll give her a round of applause anyway. 3 years, done a fantastic job. Aaliyah Koch and Dr. Isaac also were not able to attend, and like all good oral surgery residents, they're in the OR constantly. So he asked me to give a few remarks. The two graduating oral maxillofacial surgery residents spent 6 long years, not short years, long years, getting an MD and doing 1 year of general surgery in addition to their oral surgery training. They were terrific mentors to their junior residents, dental students, and they never said no. Lindsay Rutherford will be joining a private practice in Connecticut with Thomas Wilson, who's another alum, Garrett Alex, and Michael Foreman, also from the program, who had previously had worked here with Dr. Isaac and Dr. Koch. Sophia Jelke will also be joining us as a full-time faculty member. She will be named as the director by the Dean of Predoctoral Oral and Maxillofacial Surgery Education. So a round of applause for those two. Last but not least, because they treat very small people, Aaron Myers, representing Richard Yoon, the program director for pediatric dentistry. Dr. Myers.
This year's pediatric dentistry class showed up, did the hard work, and truly made the most of their 2 years at the College of Dental Medicine and New York Presbyterian Hospital. They've been tested, providing oral health care for some of the most medically complex patients in the world who are being seen at the Children's Hospital. In the CDM teaching clinic, they are the dental home for an underserved, high-risk population with extensive oral health care needs. They've taken call 24 hours a day, 365 days a year, managing trauma, infection, and pain, often late at night when patients and families are at their most vulnerable. Along the way, they have learned the value of teamwork and how to collaborate with colleagues across both dentistry and medicine. They have come to understand that pediatric dentistry is far more than treating a small tooth. It is about managing the complex medical, developmental, behavioral, and social factors that shape a child's oral health care. It requires clinical excellence, sound judgment, and the ability to work across disciplines. And perhaps most importantly, that it requires empathy and compassion, qualities they all share and will make them truly exceptional clinicians. To our graduates, simply put, you've been tested and you're ready. You have grown into thoughtful, capable pediatric dentists who will make a meaningful difference in the lives of the children and families in the communities you serve. You continue to make us incredibly proud, and as you move on to this next exciting chapters of your careers, please remember your Columbia family will always be here to support you. Congratulations.
Dr. Erica Denore Nations. Dr. Noemi Espinal. Dr. Andrea Henao Fernandez. Dr. Min J. Kong. Dr. Natalie Khalili.
Good afternoon, esteemed guests, faculty, friends, families, and the graduating class of 2026. Standing here today, I feel so grateful. Residency has been one of the most challenging and meaningful experiences of our lives. It came with early mornings, late nights, emergency walk-ins, sedation days that somehow felt 3 days long, and yes, some tears along the way. Mostly from the kids, but sometimes from us too. Somewhere in the middle of it all, I think many of us learned something important. In training, it's easy to live life constantly looking ahead. We're chasing the next step, getting in, passing boards, finishing residency, finding jobs, building careers. There's always another milestone waiting. But residency taught me that some of the best parts of life happen while you're still on the way. They happen in the middle of the chaos, in shared lunches between patients, and stressful clinic sessions that somehow become funny later, and the people you go through it with. To our full-time attendings, Dr. Yoon, Dr. Chussid, and Dr. Myers, thank you for your guidance, patience, and the standards you held us to. You shaped not only the clinicians we are becoming, but also the way we approach people, teamwork, and responsibility. We hope to continue making you proud throughout our careers. To our part-time attendings, Doctors Love, Kwok, Reynolds, Shapiro, Sood, Gibson, and Herbers, and Best, thank you for sharing your expertise, perspectives, and time with us. Each of you added something special to our training, and we are incredibly grateful. To Gerlin, Patricia, Sandra, and Alihia, thank you so much for bringing warmth and calm, even to the busiest clinic days. You are such an important part of what makes this place special. To our assistants, Idalise, Joanne, Maria, and Ariani, thank you for being the backbone of our clinic. You kept us grounded through every busy schedule, difficult procedure, and unpredictable day, and we could not have done it without you. To our rising second years, Doctors Helen, Caroline, Sophia, Jeffrey, and Molina, it has been rewarding watching you grow into confident clinicians and leaders. Your energy and heart have made our clinic better, and we know you are more than ready for the year ahead. To my co-residents, Doctors Erica, Noemi, Andrea, and Natalie, thank you for being my people. 2 years ago, the match brought the 5 of us together, and little did we know it would become one of the best things to come from residency. We've been through everything this program could throw at us, from Wednesday morning sedation rodeos to clinic days so long, I think we can recognize each other by the sound of our sighs. I'm so proud of everything we've accomplished together, both professionally and personally, and I truly couldn't imagine going through this experience with anyone else. Finally, to my family, my parents, my sister Minju, and my girlfriend Annie, thank you for your unconditional love and support through every step of this journey. Everything I've accomplished has only been possible because of you. To the class of 2026, I hope that wherever life takes us next, we remember to appreciate the moments we are living through while they're happening, not just the milestones ahead. Because one day the long clinic days, the stress, the laughter, and even the chaos might become the things you miss the most. Congratulations, everyone. Thank you.
Excuse me for 1 minute.
Hello, graduates, family, friends, our faculty, and staff. My graduates know who I am, but I'm Kelly Johnson, Director of Postdoctoral Student Services, AKA the Den Mother, their moms away from home. As I stand before you today, excited to see you step into this next chapter of your story, today is bittersweet for me. I will truly miss the moments we have shared, your smiles, hugs on the clinic floor, laughter, and even a few tears along the way. I know firsthand how hard you have worked to get here. You've all persevered through challenges, and there were days that felt heavier than expected. There were even moments when you paused and wondered if you had made the right choice, while also thinking about the mounting debt and asking yourself if all of this is really worth it. But here you are. You didn't give up. And that perseverance is a powerful testament to your strength, your resilience, and your passion as clinicians. So yes, it is all worth it. I have to give a special shout out to those of you who kept me going with coffee, snacks, chocolate, and the occasional leftover pizza. Because let's face it, you knew exactly what I needed to keep up with all of your requests, and there were a lot of them. But seriously, I am so proud of each and every one of you for what you have accomplished individually and for how you've supported one another as co-residents. I cannot wait to see all the incredible things that you'll do next. So now one last thing. I made a promise to your program directors that you would stay focused these last few weeks of clinic and that you would not mentally check out and do what you need to do to finish up. So I will see you all on Tuesday. But today is yours. Take it all in, celebrate it. You've earned every bit of it. Congratulations, class of 26.
So everyone, let's give a final round of applause to the class of 2026 and congratulate them. Incredible group. We're going to all meet for more photos, more time over there with some beverages and other food to eat and to meet and greet with your family. Many of you will leave here today and you may never look back. We understand life's complicated. But even if it's 20 years from now, CDM will be here to welcome you and your family back. This is forever your dental home. We share the responsibilities that I talked about before with this profession now with all of you. So now receive the benediction. Reverend.
I invite all who are able to please stand. Friends, as we prepare to leave this space of commencement, moving toward the next steps of our journey and our work in the world, receive this benediction, this good word, to send us on our way. May all that you have learned and accomplished on the path to this day be a blessing to you for the work ahead. May what we have commenced in our time together now sustain us for the journey ahead. May the calling you have received bring you to heal and to care in new ways in a world in great need of your care. Amen, and congratulations.
Thank you, Reverend. So allow your program directors and the dean to process off the podium before you do a mad rush to your family. Okay, once again, congratulations. We'll meet you on the far end. Thank you. Program director.